Relatives, this is Dr. H. Welcome to this week's Schlagbyte for the week September 24th, 2007, entitled Surge in Bipolar Kids? In this month's issue of the Archives of General Psychiatry, my colleagues reported a huge increase in the number of American children diagnosed with bipolar disorder or manic-depressive illness. From 1994 to 2003, psychiatrists found a 40-fold increase in the diagnosis of bipolar disorder. And this increase coincided with the rising use of antipsychotic medications for children. I am not the only psychiatrist who thinks that this surge is not real, but rather that kids are being mislabeled. Many doctors believe the bipolar disorder doesn't even occur in children. But we all agree that it's more difficult to validate psychiatric diagnoses in kids. Nowadays, a kid with extreme mood swings who may exhibit disruptive behavior or extreme irritability is called bipolar, even though these symptoms can be seen in lots of other conditions, like ADHD, the conduct or anxiety disorders, as well as depression. A generation ago, bipolar kids were apparently mislabeled as truants or troublemakers. But today, we label problematic behaviors as mental illnesses. And in spite of the fact that we can't quite define these illnesses, we know that they can be helped by powerful prescription medications. We are not witnessing an epidemic of bipolar children. What we are seeing is the result of the public's awareness about what is mental illness, and it's largely spurred on by the heavy marketing of psychiatric drugs. They are in movie trailers and TV variety shows and Super Bowl spots. These are all a marketing pipeline for selling drugs for mythical diseases. Lots of diseases. If you're tired at the end of the day and unable to wake up to life, which is their tagline, you may be suffering from narcolepsy. If you're shy at parties, you could have a social anxiety disorder. If you feel like smacking the driver ahead of you who just cut you off, you may have an intermittent explosive disorder. All of these diseases, by the way, are treatable with potent medications. We are over-diagnosing. The United States ranks #1 in the world for mental illness, with 25% of all Americans now having a diagnosable mental illness. From a generation of Americans who rebelliously experimented with drugs, we have become a generation who is now growing dependent upon them. This surge in bipolar kids is a wake-up call to an ever-increasing demand for and access to drugs to control behavior. We have got to stop defining unacceptable behaviors as mental illnesses to explain and justify those behaviors, because if we don't, we're going to change from a self-reliant nation into a herd of functional drug addicts. That's what I'm thinking this week. Let me know what you're thinking on the Healing Cafe discussion forum. For those of you interested in healing and expanding your healing power, check out the website and the upcoming December workshop here in Scottsdale. Stay connected. Nobody makes it alone. We are all in it together. I say this for all my relations. Have a great week.